Just recently, I did a presentation on natural remedies, practical. We actually did the practical demonstration in the area where we were, and we used the cabbage. So all you do, the cabbage leaves, and I'm letting me demonstrate it so I take up less time, so we can go into our.
Okay, okay, you can take the chair and you can come back here where I am. Okay, you can come around this way. And what we're going to do is, I'll tell you what, just kind of set that chair out to the side. Now I want you to look toward the camera. I don't want to cover up everything. If we can move that over some. Yeah, move that over. You move this over just a little bit so he can be able to see what we're doing. Okay, and just scoot it over just a little bit more. Okay. All right, now, what we're going to do with our first treatment is, now understand these are just localized treatments. If you're working with a person, they would have to be on a complete protocol, a complete treatment. Now, we're going to assume that he has an inflammatory knee condition, arthritis. This is just one of the procedures. We know if we work with arthritis, we need to detox and cleanse it, put him on a good, healthy diet program.
Yep.
We know we're going to do hydrotherapy. This is just a localized treatment, okay? All right, so what I'm going to ask my friend here to help me with, do we happen to have a wooden spoon or something I can beat these leaves with? It don't have to be a wooden spoon. Anything that I can kind of pound this with. Okay, it's in there, okay.
So we simply hit the leaves with a spoon or something, rolling pin or something heavy.
Okay, so I just want you, now what you want to do with the cabbage leaves, we're going to do a cabbage leaf poultice. But you have to bruise the leaves, and then we're going to apply it. So you just really take it and you bruise it like that. So he just kind of bruised these leaves just to pound the moisture out of it. And now the purpose of that is you want to bruise it so that the leaves will oxidize. And oxidizing simply means releasing the hot oxygen that's trapped in the leaves. And when that happens, it actually creates a drawing process. Okay? Or you can just simply put the leaves in some hot water and do the same thing. I like simply just bruising the leaves and doing it, but you can do it both ways. And to take this and lay this on his kneecap.
So that's about 3 to 4 leaves of the cabbage.
Okay, yeah, right on his kneecap. And then you can use paper towels or you can use a cotton cloth and we're going to wrap that. Then once you have wrapped that either with a piece of cloth, I use a lot of paper towels, and you just simply going to secure that. You can just raise your leg out a little bit. There you go. And you won't, try not to put too much of the plastic on the skin as possible. And that's basically all to it. And he can sleep with that. That's any type of pain, bruise, arthritic, sore knee, any type of sore muscle. You wrap it like that and you just leave it on, let him sleep with that on at night. And it's secure so he could get up and walk around. He could turn over in the bed and it won't even come loose.
Okay, but to secure it, this is just the plastic over it. So you need to put a bandage over that and secure that bandage so that it doesn't come off while sleeping. So that's our cabbage poultice for pain. This is just another example of using different leaves. And then we spoke yesterday with Zebulon spoke about the debriding of gangrene and sores. So we can use sugar in those sores to help to clear those sores. Sugar, when you apply sugar to the sore, the sugar will help to absorb the moisture from those sores or those wounds. It pulls the moisture out, which will help to prevent the growth of bacteria. With no bacteria in the wound, it's going to heal quickly. I remember we were working with a cancer patient, and we told the husband what to do after we put in the tumor removing salves, and the tumor came out. The wound just left a hole, so that hole needed to be closed. And we told them how to take care of that wound. She had to go to hospital for some reason, and the doctor and the nurses were amazed that she had an open wound and it had no infection and no bacteria. So it works. So we're going to show you how to apply the sugar to your wounds.
And this is where you have to make a little investment. And I did. I made my own investment because I use these as teaching aids. I go into churches and I put on a health talk, and I try to do a lot of visual because the children really get caught in it and people really get involved and they can see what's taking place. And so this is what they call cosmetic active blood. Okay, this is why they make it bleed. And I have a solution where I can make it thick and dark or red, and I have all that in my kit. I have a makeup kit where I can do whatever I want to do. Okay, so a case like this wound right here, and I work with a lot of these wounds, breast wounds like this, and even one here. I would take this sugar, and I would dump this sugar on this wound. Now, if I think it's a gangrene wound, then what I would do is maybe add iodine the sugar will actually eat it off. So sugar is a very powerful remedy for gangrene, diabetic sores, cancerous sores, anything, just on cheap sugar. And it's because sugar is such a deadly poison that even bacteria can't deal with it. Okay, it can't. It's just, when you put it on top of bacteria, kill the bacteria. So it's really good for using outside of the body, and it's not made to use inside of the body. I'm going to try to do this here. I have some more in here, by the way, and I got different types. This is one where you spit on and show a person have had their legs amputated. See, it's been cut off. And you fit that on them, like so. It'll fit on them, and so you can actually, it's got a little vein right here. If I hook it up, it's going to bleed, okay? And so you have a time period, you have to stop that bleeding. It's a training exercise. These are medical training tools. So you have a time period you got to stop the bleeding. If you don't stop it, you're going to lose the patient. They're going to bleed to death. Okay, so all of this is, I can hook all this up. Now, here's another one. I'm not going to take it out, but that's another one right there. And this is another one right here. This is a gunshot